Hi, Michael.
Hello.
My name is Patricia Ebuna. I'm a student nurse practitioner at South University. I'm here to do your head to toe assessment. Can you tell me your date of birth?
Yes, June 19th, 1999.
Do you know the name of our current president?
Donald Trump.
Okay. My patient is alert and oriented times 4. I already checked his vital signs, blood pressure, temperature, heart rate, respiration, and height and weight, and all are within normal. Even the BMI is within normal limit. I went ahead also and did the visual acuity with the Snellen chart, and her vision is 20/20. Thank you. I begin by washing my hands and start with the skin assessment. The skin is normal, there is no lesion, no skin breakdown, no open wounds noted. I'll go ahead and check the legs. My camera. Check the legs. There is no edema or open wounds noted on the lower extremities. I'll start with my head and face assessment. The hair is evenly distributed. There is no lesion. Any tenderness?
No.
There is no tenderness noted. I'll go ahead and palpate the parietal pulses. Bilaterally, it's normal. I'll go ahead and assess for the central nervous system 5, and which is the trigeminal. I start. Michael, can you clench your teeth? I'll check your. The TMG is no any tenderness.
No.
No pain, no tenderness.
No.
It's normal. Okay. I'll go ahead also and assess for the central nerve 7, which is the facial nerve. I check the motor. Can you smile? Raise your eyebrow. Puff your teeth. It looks good. It looks normal. Michael, let me know if you feel. I'm going to check the sensory. Let me know if you feel if it's dull or sharp. Okay, when I touch your face.
Dull. Dull. Sharp. Dull. Sharp.
Thank you. The sensory and motor nerves, the facial nerve, the central nerve 5 is central nerve 7 is normal. I'm go ahead and assess his eyes. The size and shape looks normal. The sclera is white. There is no drainage noted. I'm going to go ahead and assess. Like I said, I already checked the Snellen chart and it's normal, 20/20. I'll go ahead and check the peripheral vision, confrontation. Mr. Michael, let me know if you see my finger. I'm going to use a finger wiggling test. Okay, if you see, let me know, okay?
Yes. Yes. Yes.
Good. The peripheral vision is good. I'm going to go ahead and assess also the central nerve 3, the oculomotor, and also central nerve 4 and central nerve 6, the abducens muscles. I'm going to go ahead and do it now with a 6 cardinal fields. Watch me, Michael. Good. The 6 cardinal nerves is good, which means the central nerve 3, 4, and 6. the trachea, the abducens, and oculomotor, they are all within normal limits. I did not notice any nystagmus. Also, I'm going to check on the size and shape of the pupil and the symmetry of the eyes. And also, I'm going to go ahead also and check for direct, consensual, and also the accommodation of the eyes. Look at me straight, Michael. Using my pen light, it's going to help me. Good. It's very normal. There's no problem noted. I'm going to go ahead and assess the conjunctiva, the iris, and the cornea. It looks normal. Using my pen light and my ophthalmoscope, I'm going to do a more exam and focusing on the red reflex. There is no hemorrhage, no bleeding noted. Okay, I'm going to go ahead. The vessels and the structure of the eye, they are all looking normal. I'll go ahead and assess the ear, the external ear, and the auricle. It's normal. I don't see any lesion or any bleeding or any abnormal signs. The external is good and the auricle looks good. I noted a cerumen that is dry, but it's nothing much to worry. It's nothing to worry about. Also, I'm going to check the central nerve 8, the acoustic. I'm going to do the whispering voice test. Michael, when you hear, if you hear this, you hear me say something, you let me know, okay?
1, 2, 3.
6, 8, 10.
6, 8, 10.
Thank you. So it sounds he passed the hearing test with the whispering voice. I'm going to go ahead and do the Riley and Wiper test. Because I'm checking is the lateralization and also the air and bone conduction of the ear. Michael, when you hear, I'm going to use this as like this fork as my tuning fork, like, and I'm going to use it as improvise. If you hear this, Michael, let me know, and the ear you heard it, okay?
Yes, right here. Yes, right here. Yes, right here. Yes, left ear. Yes, left ear.
Okay. The Weber and Riley tests are normal. He did not, his ear is good. I'm going to use my otoscope and check the middle ear, noting the position of the light reflex. The tympanic membrane is grayish pale, shiny, and translucent. The tympanic membrane is grayish pale, grayish gray or grayish pale, shiny, and translucent. I noticed some cerumen, but it's not much. There is no sign of infection noted, no redness, no swelling noted. I'm going to go ahead and assess the nose and the sinuses. The frontal sinuses and the maxillary sinuses. Do you notice any pain or tenderness, Michael?
No.
Okay. Do me a favor. Can you close one of your ears nose and try to breathe. I'm checking for patency to the other one. Good. I'm using my pen light. I'm going to check for patency in the turbinates and nasal passages. The nasal mucosa is normal. There is no problem noted. I'm going to go ahead, and there is no tenderness on the sinuses. I'm going to go ahead and assess for the mouth and the throat. I'm going to put on my gloves, and I have my tongue depressor, and I have my pen light. So I put on my gloves, wash my hands, put on my gloves. Michael, I'm going to check, assess your mouth, okay? The lips are normal. The gums, open your mouth, open your mouth. There is no sign of gingivitis, no artificial teeth or dentures noted. Open your mouth. Using my tongue blade, say ah. I noted the tonsil, the uvula is in the centrally located, and I noted the tonsils on the bilateral sides. The hard palate is normal. There is no problem noted. Sorry, Michael. I put tongue depressor in your mouth. Using my pen light open, I assess the mucosa on the oral cavity. There is no problem noted. Everything looks good. The size of the tonsil is within normal limit. I'm going to go ahead and assess for central nerve 9, which is the glossopharyngeal. So I'm going to give him water. Michael, open your mouth. Don't swallow until I ask you to swallow, okay? So I'm going to assess. Swallow. Note the size of the trachea of the goiter. It is good, normal. The trachea size is normal and location is good. I'll go ahead and assess the cranial, the cervical lymph nodes. Pre-auricle, post-auricle, occipital, submandibular, and submandible. Also, posterior cervical, anterior cervical, superficial cervical, the tonsillar, and supraclavicular, all in place. I check the axillary nodes. Any pain, any tenderness, no. Michael? You okay? I palpate for any mass. It looks no enlargement, no nodules noted. I'll go ahead and assess the cervical, the carotid pulse. That's no problem noted. Michael, go ahead and do your shoulder. Can you shrug your shoulder? Both shoulders are symmetrical. There is no problem noted. There is no edema, no swelling, no sign of dislocation. Okay. check the movement of your in, out. Okay. All the flexion and of the shoulder looks normal. The flexion, the extension, the abduction, the internal and external rotation are all normal. I'm going to go ahead and check the central nerve system 11, the spinal accessory with the shoulder up, which I did, but I'll go ahead. I could show against resistance, and it's within normal. The epitrachea, the nose, the bilateral, no deformity and no tenderness noted. I'll go ahead and check the brachial pulse, the arterial pulse, the arterial pulse, the brachial pulse, and it's all normal. Okay, I'm going to go ahead and check the upper extremities. The capillary refills are less than 2 seconds. It's less than 2 seconds. Michael, I'm going to check your upper extremity range of motion. Okay. Let me check your muscle strength. I'll try to push you down. Do not let me. Okay. Good job. I like to show you. Do not let me. Good job. It looks good. Good pauses. Okay. I'll go ahead. I'll go ahead and do your abdominal. No, let me do your chest assessment. I'm going to do the arterial assessment first. I do inspection. There is no use of accessory muscles to breathe. The respiration is unlevered and regular. I'm going to go ahead and I'm going to go ahead and auscultate. Aortic, pulmonic, tricuspid, and mitral. Cardiovascular. Take a deep breath. Again. 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 Thank you. That's no abnormal breathing noted. I'll go ahead. Let me know if you feel. I'm checking for fremitus, tactile fremitus. If you feel my hand, you say 99?
99. 99. 99.
Good. I'm going to go ahead and check posteriorly. I'll go by. Inspection, no problem. I'm going to take a deep breath. Okay. Again. 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 Okay. I'm going to check for tactile fremitus. If I touch your back, you feel it, you say 99?
99. 99. 99.
Thank you. There is no problem noted. So Michael, I need you to come to the left so I can assess your abdomen. I start by inspection. There is no striae, there is no lesions noted, there is no use of accessory muscles for breathing, and I'll go ahead and percuss focus and auscultate for vowel sound. I'm going to check the aortic and iliac. And renal arteries and femoral. I'm gonna go ahead and focus. Any pain or tenderness?
No.
Okay, if there is pain or tenderness on the right lower quadrant, it indicates like appendicitis, which is not good. I'll go ahead and assess for the liver and span for the liver edge. I got like normally is 12 millimeters, 6 to 12 millimeters, but Michael's own is 7.5 millimeters, which is within normal range. Any tenderness?
No.
Any pain?
No.
Any tenderness? Any pain?
No.
No. Okay, good. I'm going to go ahead and I'm going to do a light and deep palpation, okay? Let me know if you have any pain. Any tenderness?
No.
Any pain?
No.
Okay. I'm gonna go deep. Any pain?
No.
Any tenderness? Okay, I'm gonna go ahead and check for rebound. Okay. Rebound tenderness. Any tenderness?
No.
No. Good. Thank you. Go ahead and feel for any edema to the lower extremities. There is no skin lesions, no edema, no swelling noted. Check for femoral pulses. Patella, knee pulses. Tibialis muscle, dorsalis pulses. Is good. I'll do something here. Dorsalis. Capillary refills are less than 2 seconds. Is good. I'm going to go ahead and assess for Babinski sign, which can show diabetic neuropathy. Good. Good. It's normal. I'm going to tell me if you're feeling a sharp or dull sensation.
Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Dull.
Okay, it looks normal. I'm gonna go ahead and get you down. I'm going to assess your lower extremities, muscle strength, okay? Your coordination. Turn over here. Okay. Michael, I want you to walk towards me. Good. Go back. Can you close your eyes? Stand there. Close your eyes. Open your eye. Straighten your hands. Close it down. Can you walk toe, knee, toe, knee, walk to me? Thank you. Can you walk knee and backward? Only knee walk. Knee walk. Thank you. Can you walk to the back? Okay. Thank you. Michael, can you touch? I want to check your spinal nerves. Okay. Good. Stand up. Okay. Everything looks good. I want to check your strength, your lower extremity strength. Can you lift your leg up? Don't let me push it down. Good. Do the same. Don't let me push it down. Good. Okay, Mr. Michael. Can you have a seat? Thank you, Mr. Michael. That's the end of my assessment. I thank you so much. Do you have any question for me?
No.
Everything went fine.
Yes.
Thank you. I appreciate it.